So, good morning, Mr. Marty Bunagan. I am Michelle and I will be your student nurse for today. So, what would you like me to call you?
Marty.
Okay. Marty, for today we will be assessing your lungs, your axilla, and your heart. So, for this procedure to be more successful, we're going to need you to take off your shirt later on. Is it okay with you? Okay, so we will be checking for your circulatory and respiratory systems to find any abnormalities. Okay?
Okay.
So, shall we start now?
Michelle.
Okay. So we're gonna start by assessing the posterior thorax of my patient. I had him take off his shirt and he turned his back to me. So as per observation, the patient's spine seemed to be in midline position. Breathing seems to be normal and symmetrical. No use of accessory muscles. There are no obvious physical deformities. No masses, swelling, any lesions, or any type of redness. So now we're going to check my patient's anterior-posterior diameter with the lateral diameter. And I'm going to use my stethoscope. So I'm just going to fold it in half now. Could you raise it for me? Okay. So the ratio is 2:1, which is perfectly normal. We're checking this to see if the patient may have barrel chest, and barrel chest may indicate that the patient may have COPD or emphysema. Now we're going to continue to palpate our patient's posterior thorax. We're just going to check the temperature or any masses. So tell me if you feel any pain as I touch you, okay? So patient's temperature is normal and there are no masses as per my palpation. Now we're just going to palpate if the spine is really in midline position. So spine is in midline position. So now we're going to check for tactile fremitus. So Marty, what I want you to do is cross your arms, please. And as I touch your back, I want you to say out 99, okay? Okay, can we start? Okay. 1, 2, 3.
99. 99. 99. 99. 99.
Last one.
99.
So, okay, you can put your arms down now. So, Marty does not have any fremitus. Now we're going to proceed to percuss Marty's back to check the sound elicited or to check any abnormalities. So there seemed to be no abnormal sounds elicited when I did the percussion. Now we're going to check for the patient's diaphragmatic excursion. So the diaphragm is here. So I want you to wait. So the patient's diaphragm seems to be here. Okay, so I want you to inhale. Okay, exhale. Now we're going to start to auscultate our patient. Gonna check for any abnormal breath sounds. We're gonna warm our diaphragm. So breathe in, out, in, out, in, Okay. So there seem to be no abnormal breath sounds elicited. So we're now going to start to inspect the patient's anterior thorax. So as per observation, patient has no masses, no lesions, no redness or swelling, and breathing seems to be normal. Chest is symmetrical, no use of accessory muscles when breathing, no shortness of breath. So could you inhale for me? Full inhale. Okay, so as we can see, the coastal margin seems to be symmetrical and off 90 degrees. Now we're going to check for the respiratory expansion, just like we did with the posterior. I'm going to place my thumb on the 10th rib and on the flanks. So I want you to breathe in for me, okay? Inhale. Full inhale. Exhale. Inhale. Exhale. Inhale. Exhale. The inhalation of the patient seems to be normal, and also the exhalation. It is symmetrical, both the left and the right side. No abnormal expansion. So we're going to proceed to palpating the patient's anterior thorax. I'm gonna do the 99 again. So I'm gonna touch you again, and I want you to say 99, okay?
99, 99, 99, 99, 99, 99.
So there seem to be no abnormalities, or there is no fremitus. We're gonna percuss our patient now. So I'm gonna place my finger again and percuss you, okay? Okay. So we're gonna start off with a resonant sound until we reach the heart and the liver. Okay, so the sound elicited was resonant from here, and it became dull when we came to the heart and the liver. Now going to auscultate our patient. I'm going to place my diaphragm on you again. I want you to breathe in and out, okay? Okay. So patient's breath sounds are normal. With the consent of the patient, expose the breast area. As we expose, we inspect for any masses, any lesions, any abnormal findings, or physical deformities. So for this case, the dummy was kind of broken, but let us assume that there are no abnormalities and everything is normal with the breast. So for palpation, we're gonna follow this manner of palpating the breasts of the patient. and we're gonna check for any masses or swelling or areas of tenderness. We're now going to proceed to the patient's axilla. For this, we're only going to do inspection and palpation. So could you raise your arm for me? Okay. So it is of the same color as his body, and it is with body hair as he is a male patient. So the other side, please. Okay, so the same color with the body and with hair also. There is no lesions, no masses, no swelling, no redness or any abnormalities with both the axilla. So it is normal. We're now going to palpate our patient's axilla for any masses, any lesions, any tenderness. So I want you to tell me if you feel any pain as I palpate your axilla, okay? So could you raise it for me? You feel any pain? Okay, let's put it down for me. Tell me if you feel any pain, okay? Okay. We're now going to proceed to the other side. Okay. Face it again. Tell me if you feel any pain. Do you feel anything? Okay. So as I was palpating the patient's axilla, there were no complaints of any tenderness or pain. Also, there were no masses. So now we're going to measure the length between the internal jugular pulsations with the sternal angle. So we're going to look for the highest point of the pulsation. So it's here. So could you hold this for me? Okay, and we're going to line it to the sternal angle. And we're going to measure it. So the length was 3 centimeters, which should be, and it is normal. 3 centimeters or more may mean that the patient may have increased jugular vein pulsations. Now we have the chest of the patient. We're just going to locate the angle of fluid, Erb's point, and the point of maximal impulse. So the angle of fluid is... Okay, so it's over here. So Erb's point is over here, and the maximal point of impulse here. We're now going to palpate for thrills and pulsations. So we're going to start with the aortic. The Erb's point. The tricuspid, and the mitral. We're going to start percussing our patient. We first need to find the angle of Louis. Okay. Then to the second intercostal space, to the third, and we're going to start percussing and looking for the base of the heart till we reach a dull sound. We're going to mark the area to which the dull sound occur, and then we're going to go to the fourth intercostal space. Same, we're gonna look for the dull sound. So we're using skin-friendly markers. And to the 5th. And this marks the apex of the heart. So it has an angle. So we percussed by looking for the sternal angle first, then to the second intercostal space down to the 3rd. And then we started percussing till we heard a dull sound. Then we went to the 4th, then to the 5th until we found the dull sound. So we used the technique from lateral to medial to find the dull sound. We're now going to auscultate our patient. We're going to listen to the heart sounds and look for abnormal sounds. So we're going to do it from the aortic, pulmonic, tricuspid, the Erb's point, and to the mitral valve. So we're going to start. The Erb's point. The tricuspid. And to the mitral. So all sounds came out as normal. There were no abnormal sounds elicited. So we're gonna get the respiratory rate of the patient. So can I have your hand, please? The other side. We're gonna check for his heart rate for a whole minute. So Marty, as we assessed your lungs, your heart, and your axilla, everything went normal. There were no abnormal findings, so all is well and all is normal.